When it comes to answering the question of what's the most dangerous psychiatric medication available, there's not a lot of debate, and that's because there is one psychiatric medication that is far more dangerous than all the others, and for that reason has far more restrictions on prescribing it than all the others. That medication is a medication known as Clozapine. This medication was originally sold in the United States under the brand name Clozaril. Clozapine is the generic name. Clozapine is an antipsychotic primarily used for the treatment of schizophrenia. It was the first so-called second generation or atypical antipsychotic. Clozapine was originally put on the market in 2 European countries, Switzerland and Austria, in 1972, and 2 more European countries, West Germany and Finland, by 1975. By 1975, it became apparent that this drug was basically wrecking people's immune systems. That's because it caused a syndrome known as agranulocytosis. When you have this condition, your body stops making granulocytes. These are the most common forms of white blood cells that you have, and they are an important part of your immune system. Without them, you become very vulnerable to even minor infections. A minor infection can end up killing you. The fatality rate of agranulocytosis is as high as 30%. So Clozapine ended up being withdrawn from the market in the countries it was approved in 1975. Now, there's more than one reason why a drug company would voluntarily withdraw a medication from the market. In this case, it was most likely because they knew that if they did not voluntarily take it off the market, regulatory agencies would likely recall it. But then there was more research done on Clozapine, and it turned out that Clozapine was more effective at treating treatment-resistant schizophrenia than any other antipsychotic. Antipsychotics are also known as neuroleptics and major tranquilizers, by the way. In light of evidence that it was more effective than other antipsychotics, they applied to have it put on the market, and in 1989 it was approved. But the FDA did say, well, we'll approve Clozapine, but we're also going to put more restrictions on prescribing it than we've ever put on any other medication before. Here are some of the more important FDA-mandated restrictions on Clozapine. Both doctors prescribing and pharmacies dispensing Clozapine must be specially certified. Clozapine cannot be used unless at least 2 other antipsychotics have been used first and the response was not adequate. This is actually a very severe restriction because the FDA almost never mandates that a drug cannot be used under any circumstances as a first-line treatment, but they actually did make that mandate with Clozapine. That means that unless you have tried at least 2 other antipsychotics and the response to them was not adequate, you simply cannot go on Clozapine. Another restriction is continuous blood tests are required for Clozapine users to monitor for agranulocytosis. This is also a pretty severe restriction, and it's known as the No Blood, No Drug program. It's not uncommon for doctors to want blood tests when they put someone on a medication, but it's very unusual for the FDA to absolutely mandate that blood tests be done. The way it works right now is for the first 6 months that someone takes Clozapine, they need to get a blood test every single week. For the next 6 months, they need to get a blood test every 2 weeks, and then after that, they need to get a blood test every 4 weeks. They really mean it when they say the No Blood, No Drug program, because if you are on weekly blood testing, for example, they will only dispense 7 days worth of Clozapine after you get a blood test. There are a lot of Clozapine apologists out there that will try to tell you that agranulocytosis is the only significant risk that Clozapine has. And they will say that besides agranulocytosis, it's really not much more risky than the average medication. This is not true at all. Look, I'm not trying to say that nobody under any circumstance should ever go on Clozapine, but I am saying that there's no purpose to pretending that this medication is safer than it actually is. Even if agranulocytosis was not a side effect of this medication, it would still be a very dangerous medication. Clozapine has 5 black box warnings. Black box warnings are the most severe type of warning that the FDA can require and are considered one step away from recalling the medication. It is very unusual for a medication to have 5 black box warnings, but clozapine actually has that many. The first black box warning that it has is agranulocytosis, which is indeed probably the most notorious side effect this medication has. However, the other black box warnings are quite severe, even though they are rarely talked about. The next black box warning that it has is orthostatic hypotension, bradycardia, and syncope. That means that it can cause low blood pressure, slow heart rate, and fainting or loss of consciousness. Clozapine actually has quite a lot of cardiovascular side effects. People just don't realize it. Clozapine can also cause, interestingly, high blood pressure and heart rate that is too fast. The next black box warning is seizures. Clozapine actually has a relatively high risk of causing seizures, especially when used in higher doses. Clozapine also carries a black box warning for myocarditis and cardiomyopathy. That means that clozapine could potentially cause the inflammation of the heart muscle and the inability of the heart to pump blood to the rest of your body. Both of these conditions could potentially be fatal. Finally, clozapine has a black box warning for the increased risk of death in elderly patients with dementia-related psychosis. The truth is, clozapine has never really been proven to be very effective in the treatment of dementia. If there is any evidence that it works, it's quite limited. But that doesn't prevent it from being prescribed for this purpose. And that is dangerous because it does significantly increase the risk of death for these patients. In addition, clozapine has more very serious side effects that are actually quite common that are not listed as a black box warning. But before I get into those, I want to give a little bit of a background on schizophrenia and what treatment-resistant schizophrenia is. Schizophrenia is typically divided into 2 or 3 different types of symptoms: positive symptoms, negative symptoms, and cognitive symptoms. Now, the primary symptoms of schizophrenia are the psychotic symptoms, which are usually considered positive symptoms. There are some people that think that the cognitive symptoms should be the primary symptoms. I disagree with this. I'm not going to go too much into that in this video. I might in another video. But I will say this. The American Psychiatric Association currently calls schizophrenia a psychotic disorder and says that it's primarily a psychotic disorder, and they have always done so. The most common psychotic symptoms are hallucinations and delusions. You can also see disorganized thoughts listed as positive symptoms, and that makes sense because what they mean by disorganized thoughts are when certain thoughts come into your mind that are not really your own thoughts or don't seem like your own thoughts. And in a way, a disorganized thought is sort of like a hallucination that occurs only in your mind. Usually, what are called hallucinations are things that occur in your sensory perception. The most common type of hallucinations that schizophrenics hear are vocal hallucinations. They often hear voices. There's a misconception that schizophrenics primarily hear these voices in their head. Usually, they hear the voices outside of their head. It almost sounds like there is someone in the same room talking to them. However, even though they can hear the person, if it's just an auditory hallucination, and it doesn't always have to be a person, it could be an alien or something like that, but they won't see the person in the same room with them, so it'll be a disembodied voice. The second most common type of hallucinations are visual hallucinations, but these only occur in 27% of people who are schizophrenic, unlike vocal hallucinations, which occur in the majority of people who are schizophrenic. And typically, when somebody has visual hallucinations, they usually will not have them as often as they have vocal hallucinations. There are some exceptions, and there also can be things like tactile and taste hallucinations as well. These delusions are mistaken beliefs that are held in spite of superior evidence to the contrary. Now, there are two types of delusions. One type of delusion comes from the hallucinations. Let's say that you hear a voice, and it's the voice of God. And the voice of God is telling you that you are an angel, and you are on a special mission from God. And you might believe this. Well, this is a delusion, but it's a delusion that comes from hallucinations. Sometimes people who have schizophrenia don't have delusions at all. Sometimes people who have schizophrenia do have delusions, but they are only delusions that come from their hallucinations. So, in that case, if the person did not have the voice of God tell them that they were an angel sent on a certain mission, the person would not actually have the delusion that they were an angel sent on a certain mission. In other cases, people can have delusions that are independent of the hallucinations. I want to point out that in order to be diagnosed with schizophrenia, you must have at least one positive symptom. If you just have negative symptoms and cognitive symptoms, you do not have schizophrenia. Then we have the negative symptoms and the cognitive symptoms. In both cases, the negative symptoms and the cognitive symptoms could be caused by something else. One negative symptom is aloga. This is referred to as reduced speech even when encouraged to interact. This often means that the person will not really give very elaborative answers to questions. Like if you ask them a question, they'll try to give you a one-word answer or the minimum amount of information that they could possibly give you in order to answer your question. The next negative symptom that is listed is affective flattening, or the lack of emotional and facial expressions. The next negative symptom listed is avolition. They describe avolition as diminished ability to begin and sustain activities. What avolition really is a lack of motivation. It's just a feeling that you're not very motivated to do anything. And yes, that can manifest as a diminished ability to begin and sustain activities, but it's best thought of as a lack of motivation. Another negative symptom is anhedonia, which is a decreased ability to find pleasure in everyday things, and also social withdrawal. Then there are the cognitive defects, which can include things like problems with your memory, problems with attention, problems with planning, and problems with decision making. I want to point out that antipsychotics are called antipsychotics, and that's because they are primarily effective at dealing with the positive symptoms of schizophrenia, especially hallucinations and delusions. When it comes to things like negative symptoms and cognitive symptoms, they probably make these symptoms worse. In some cases, they might even create them. The reason for this is all antipsychotics work, at least in part, by antagonizing the dopamine receptors. Now, perhaps in the future, they will develop antipsychotics that don't interfere with dopamine, but currently, the antipsychotics approved for schizophrenia all interfere with dopamine to some extent. Dopamine is a very important neurotransmitter, and higher levels of dopamine are associated with higher motivation, the ability to feel pleasure, and the ability to focus and concentrate and pay attention. The negative symptoms of schizophrenia, which include lack of motivation, the inability to feel pleasure, and the inability to pay attention or focus, all of these things are made worse by antipsychotics because of their antagonistic effect on the dopamine receptors. Now, I have been critical of antipsychotic medications in the past because they are amongst the most dangerous types of medications that psychiatrists can use. For more information, see my video on the top 3 most dangerous psychiatric medications. But one thing I will say about antipsychotics that is positive is when it comes to getting rid of psychosis and being an antipsychotic, which means getting rid of things like hallucinations and delusions, they actually are quite effective. Within 6 months of taking and staying on an antipsychotic, most people who have schizophrenia will experience all of their psychotic symptoms go away. 70%, in fact, experience all of their psychotic symptoms go away. So if they are hearing voices, for example, and if they are having delusions, those will completely go away within 6 months for 70% of them. In addition, after a year, 80% of people who take antipsychotics will experience all of their positive symptoms go away. So no more voices, no more hallucinations, no more delusions, no more disorganized thoughts, in the sense of no more thoughts being inserted into their minds that doesn't seem to come from their willpower. The problem with treatment-resistant schizophrenia, which is what Clozapine is approved for, is there is no agreed-upon definition of what treatment-resistant schizophrenia really is. One way to define it is if your hallucinations and delusions do not totally go away. Well, let me tell you something. Yes, it is required that you go on at least 2 other antipsychotics and you try them, and they have to fail in order for you to start Clozapine. But if the antipsychotics have achieved the state in which you do not experience any hallucinations or delusions, there is no reason for you to start Clozapine. I have heard psychiatrists tell people that because they are experiencing negative symptoms, and in many cases these negative symptoms are actually being caused by the antipsychotic, that they should consider switching to Clozapine. Please don't listen to a shrink that tells you this. And that's because Clozapine will not improve negative symptoms or cognitive symptoms. If you are not experiencing any hallucinations or delusions, there is no reason to go onto Clozapine. The only thing that Clozapine can help you with is if other antipsychotics have not succeeded in making all of your hallucinations and delusions go away, then you may want to try Clozapine. But I implore you, please do not rush into taking Clozapine. The reason for that is there are a lot of Clozapine apologists that seem to think that people should start Clozapine as soon as possible. Again, I disagree. As I mentioned before, 70% of the time, people who take antipsychotic medications will have all of their delusions and hallucinations, in other words, their psychotic symptoms, go away within 6 months. But they almost never completely go away when you first start taking the antipsychotics. A lot of times they'll go away in 1 month. Sometimes it will take 3 months. Sometimes it can take 6 months. So you should try taking an antipsychotic other than Clozapine for at least 6 months to see if your hallucinations and delusions go away completely. In fact, because 80% of the people who take conventional antipsychotics will experience their hallucinations and delusions go away completely within a year, you should consider taking another antipsychotic besides Clozapine for up to a year before you even think about trying Clozapine. In addition, it's required that you take at least 2 other antipsychotics before you take Clozapine. But that does not mean that you should automatically take Clozapine after using 2 other antipsychotics. It might be a good idea to try several other antipsychotics before you resort to Clozapine, which is a drug of last resort for a reason. I hear about shrinks pushing Clozapine onto people all the time, and frankly, I don't think that this is a good thing. There are those that claim that Clozapine is underutilized. I disagree. I think it's overutilized. Once again, I'm not saying that you should never use Clozapine under any circumstances. I'm just saying, realize that when you use Clozapine, you are playing with fire, and you need to be careful. Also, sometimes schizophrenia can be curable. See my video, How to Cure Schizophrenia Permanently, for more information on that. Also, it should be noted that Clozapine does not always work. It supposedly works better for treatment-resistant schizophrenia, although there are some studies that say that it doesn't. But there are many studies that say that it does. However, it is only effective 30 to 60% of the time, meaning that 40 to 70% of the time it is not effective. The thing is, you should not be taking Clozapine for too long if you do not see any improvement over what you had when taking other antipsychotic medications. A trial of clozapine should last between 3 to 6 months, but no longer. If you are going 3 to 6 months and you don't have any increased benefit to clozapine, then you should discontinue the clozapine. In medicine, it's always important to consider if the benefits outweigh the risks. In the case of clozapine, the risks are unquestionably greater than the risks of any other antipsychotic. It is bad medicine to increase somebody's risks if they are not experiencing any greater benefit. I also want to say that if clozapine does get you to the point where you are no longer experiencing any hallucinations or delusions, that doesn't mean you need to stay on clozapine forever. You may want to stay on that dose for maybe 3 or 6 months and then try reducing the dose of clozapine, or try switching back to a different antipsychotic. You may find that while it required clozapine to get you to the point where you got all the hallucinations and delusions to go away, you may not need clozapine to maintain that state. Or if you do, you may not need as high a dose of clozapine. To determine which are the most dangerous medications approved by the FDA, Health Grove compiled data from 2004 to 2015 on the number of serious adverse reactions reported for all drugs approved by the FDA for any purpose. This included over-the-counter medications. Clozapine had the 5th highest number of severe adverse reactions for any medication overall, and had the highest number of severe adverse reactions for any psychiatric medication. It should be noted that the number 1 adverse reaction that clozapine had was death. This is quite remarkable, especially when you consider that most of the other medications on this list are actually used a lot more often than clozapine is. There are many serious side effects that clozapine has that are not listed as one of its black box warnings. There are too many of those for me to tell you about all of them in this video, but I will tell you about a few of them. One of these side effects is substantial weight gain. All antipsychotics are notorious for causing a lot of weight gain, but clozapine is by far the worst. It's not uncommon to hear about people gaining 50 or even more pounds simply by taking clozapine. The only other antipsychotic that comes as close to being as bad when it comes to weight gain as clozapine is Zyprexa. Zyprexa is the antipsychotic that is the most chemically similar to clozapine. So if you discontinue clozapine and you want to take an antipsychotic that will cause less weight gain, don't use Zyprexa, use something else. There was one UCLA psychiatrist that said that taking Zyprexa is like adding an additional 1,500 calories per day to your diet. If that's true, then taking clozapine is the same or even worse than that. According to this particular study, 50% of patients became substantially overweight by taking clozapine. For some people, the amount of weight they gain from clozapine eventually reaches a plateau, but for others, they seem to just keep gaining weight. If this happens to you, you should strongly consider either switching off of clozapine or reducing the dose. Another significant risk of clozapine is that it is quite likely to cause diabetes. 34% of the people who take clozapine for 10 years will develop diabetes. If you do develop diabetes or hyperglycemia while taking clozapine, you may want to strongly consider switching off of clozapine, or at the very least, reducing the dose of clozapine. The longer you take clozapine, the higher your risk of developing diabetes gets. If you already have diabetes, clozapine will quite likely make this worse. Also, diabetes could be independent of weight gain. In other words, it is possible to develop diabetes while taking clozapine, even if you did not gain any weight while taking it. Once again, if you are going to switch to something else, Don't switch to Zyprexa because Zyprexa is almost as bad as Clozapine is for diabetes. Another serious side effect of Clozapine is Clozapine-induced gastrointestinal hypomotility. This condition, often referred to as CIGH, can cause severe bowel obstruction, constipation, and even death. According to this study, 19% of the people who got CIGH died from it. In addition, even if you don't get full-blown CIGH, it is quite common to get severe constipation with Clozapine. Around 20% of the people who take it have this problem. It's also quite possible to get severe sedation from Clozapine, and it's not uncommon for people who take this drug to sleep 12 hours or more per day. It's also quite possible to get hypersalivation from Clozapine. Like I said, there are just too many side effects for me to list in this video, but quite a lot of severe side effects do happen with Clozapine. Again, I am not trying to say that Clozapine should never be used under any circumstance. What I am trying to say is Clozapine is a very dangerous medication. Its most well-known adverse reaction is agranulocytosis, but this is not the only major adverse reaction that it causes. And people who tell you that it's basically safe other than this one particular reaction are not telling the truth. I also don't believe that this drug is underutilized. I believe that it is overutilized. I have heard from numerous sources that this drug is not nearly as restricted in Germany as it is in the United States. So if you live in a country like Germany where it's less restricted, you need to be particularly cautious about having some shrink try to convince you to take Clozapine when you don't need it and it's too risky for you to be using. Even though not everyone who takes Clozapine will get full-blown agranulocytosis, it should be noted that most people who take it will experience a drop in their white blood cell count, particularly their neutrophils, which are a type of white blood cell. These people will often need to discontinue the Clozapine until their white blood cells go back up. Just understand that Clozapine is by far the most risky psychiatric medication available. It is a very dangerous medication. It has a lot of severe side effects, and if you go on it, you are playing with fire. Please take into account the fact that it is such a dangerous medication when deciding whether or not you should start it or whether you should continue to take it. So if you like this video, go ahead and click the thumbs up, and for more videos on topics such as mental health, click the subscribe button, click the bell icon for notifications, join the Zork Army, and together we shall take over the world. You can also follow me on Twitter, Instagram, and Snapchat at ZorkMid123.